Hello and welcome. I'm Josh Schimmels, publisher and CEO of the Los Angeles Business Journal. It's a privilege to be here today hosting our 2026 Healthcare Roundtable discussion. Healthcare is entering a defining moment, as it seems to always be, right? Advances in medicine, AI, changing regulations, and new models of care are reshaping the industry at a really remarkable pace. Organizations across Southern California are not only responding to these changes, but they're helping to lead them. They're investing in research, they're embracing innovation, and they're all reimagining how care will be delivered in the years ahead. Today's discussion is going to examine the forces shaping the healthcare of the future. From groundbreaking research and medical innovation to legal developments, financial sustainability, which is also so important, outpatient care, and the strategic decisions influencing the next generation of patient care. Joining us today are leaders from the healthcare delivery world, academic medicine, cancer research, and healthcare law who are helping define what is next for our industry. Before we jump in, I'd like to extend a sincere thank you to our partners for coming together and to be a part of this conversation and for their support. ALS Network, City of Hope, Denton's, Emanate Health, Hooper, Lundy and Bookman, and UCLA Health. Thank you all so much for continuing to be a part of this conversation and for all that you do to keep our community of business safe and healthy. All right, we've got a lot of great content to get into, so let's get to it. Please join me in welcoming today's speakers. First, Carl Schmitz, partner of the co-chair of the business department at Hooper, Lundy and Bookman PC. Janice Spiso, president of UCLA Health, CEO of the UCLA Hospital System, and associate vice chancellor of UCLA Health Sciences. Robert Stone, CEO, City of Hope. And joining us as our moderator today, please welcome Robert Miller, partner and co-chair of the business department at Hooper, Lundy and Bookman. Welcome, Robert. I'm going to hand it over to you. Looking forward to a great discussion.
Thanks, Josh, and thank you all for joining us today. I'd love to start off with a question for each of our panelists. Healthcare organizations are navigating rapid change, from evolving regulations and groundbreaking medical innovation to changing patient expectations and new models of care. I'd like each of you to briefly share your outlook for the healthcare industry over the remainder of this year and beyond. What gives you the greatest confidence as you look ahead? Carl, let's start with you.
Sure. Thank you, Rob. Well, I think that we're in the beginnings of a really potentially some incredible changes and improvements in the healthcare industry. The downer, so to speak, is I think there's going to be continued financial pressures and the reimbursement environment is going to continue to be challenging. And I don't see that changing anytime soon. But I think there are real opportunities here for providers to be able to ask important questions about their patient populations and to marshal and analyze data in a way that they haven't been able to do before. That's going to really allow them to ask really good questions about what are the key drivers in their population's health and allow them to design sort of specific targeted actions to address those. And not a shameless plug here, but my greatest confidence really is the leadership that we have in healthcare. We have just incredibly smart, dedicated folks. And I think that they're going to be able to take that expertise and couple it with the rapid technological advancements we're seeing and do some really amazing things.
Janice, do you want to go next?
Well, thank you, Robert. And that's an excellent question to start us out with. And similar to some of the things that Carl has mentioned, really what we're seeing is one of the most challenging, but also one of the most exciting times in healthcare. And I really feel that the industry will continue to evolve rapidly, shaped by all the advances that we're seeing in technology. That, coupled with the financial pressures that we're all dealing with, changing workforce expectations, changing patient expectations, I think we have new demands to meet as well. We're seeing definitely that patients are increasingly wanting more seamless, coordinated timely care and more personalized care. And at the same time, we're embarking on some really wonderful innovations, such as all the advancements in artificial intelligence that are not only improving the quality and safety of care, but also efficiency and clinical decision making in real time. With all of that, though, what we continue to really struggle with are the rising costs, and that remains a key challenge that really forces health systems now to deliver that high quality care while maintaining affordability. So certainly at UCLA Health, we're focused on addressing these dynamics by advancing our innovation, expanding our efforts in value-based care, expanding access to really meet the capacity demands we have. We're a system that operates at over 100% capacity throughout our 5 hospitals and 300 clinics. And so we've been implementing strategies that will both enhance efficiency and the overall value of care for the various communities that we serve throughout Los Angeles.
And Robert, would love to hear your perspective on this topic.
Well, with the great answers that Janice and Carl gave, let me start by answering your second question first, Robert, and what gives me the greatest confidence. And we really do live in a wondrous era where new medicines are helping patients beat their disease. That wasn't the case 10, 20, 30 years ago. Think back to how much we've learned since President Nixon signed the National Cancer Act in 1971. The 5-year survival rate for all cancers is now right around 70%. And that's a huge increase from what it was back in the 70s. And the survival rate for metastatic cancers has doubled since the mid-1990s. So there really is cause for optimism. But we've got to remember that these breakthroughs only matter if they reach patients who need them the most and do so as quickly as possible. I like to say that for cancer patients, wait is a 4-letter word. And today, unfortunately, too many patients are not receiving the latest treatments that could have given them the best chance to survive a cancer diagnosis, which leads to the first part of your question regarding the outlook for the health industry for this year and beyond. I think the industry will and must undergo incredible change. AI is both an opportunity and an operational challenge. There will be an increased focus on creating access to expert and compassionate care that gives patients the ability to be treated with humanity and gives them the best chance to survive. And you'll see an expansion of NCI cancer centers, local providers, insurers, biotech firms, policymakers, philanthropists. It's those groups coming together all with the goal of supporting cancer patients. So at the end of the day, I remain deeply optimistic about the future of healthcare, but that optimism must be matched with a sense of urgency. We all have a responsibility to advance science, to accelerate cures, and to ensure that those breakthroughs, those things that give us so much cause for optimism today, that those reach more and more patients.
Thank you very much, Robert. I am optimistic about this conversation. I think this is going to be really exciting. Janice, I want to come back to a comment that you had made. You touched on how rapidly healthcare is evolving, AI and precision medicine, but in particular, the patient's desire for seamless and timely and personalized care. When you look at innovation happening across the industry today, what trends are you most optimistic about in that space? Oh, Janice, you are on mute.
Thank you. And definitely when looking across the healthcare landscape, and it's really wonderful to be at UCLA Health with our David Geffen School of Medicine and all of our research centers, because we're really working hand in hand to really translate that research from bench to bedside. And it makes me particularly optimistic about the shift toward more predictive and personalized proactive care. And we really feel here at UCLA Health, we're really at the forefront of advancing both science and its clinical applications. So just a few examples of some of the most promising areas certainly is our genetic and precision medicine, including big breakthroughs we've had. Certainly CRISPR, which offers the potential to treat and in some cases cure diseases at its sources. These advances are really transforming how we approach conditions like sickle cell disease and other inherited disorders that have historically required lifelong management. One of the other big things at UCLA, and I know the LA Business Journal has published about this, is our exciting public and private partnership with the California Immunology Institute, where we, at the former West Side Pavilion, special thanks to support from the state and private philanthropy, we're going to be bringing in researchers from all over the world to really study all of the immunology effects of disease and really feeling like we can bring forward cures faster. We're going to be co-locating our quantum physics department from UCLA there so that we can really use those large AI tools to really drive some of the research. So it's really exciting to look at how we can begin tackling these diseases even before they start in the population. And that momentum really aligns closely with our commitment to translating innovation into real-world impact. So we're really focused right now on advancing those next generation therapies, expanding our access to clinical trials. I think one of the great things about Los Angeles, we have many institutions, some of them are my colleagues on this call, working together to really treat and cure cancer. And it's really wonderful to have all of that talent in one city. So we're really trying to ensure that these cutting edge discoveries really meaningfully improve outcomes for the very diverse communities that we serve in Los Angeles.
And that's a great segue into the comment I'd like to come back to next. And Robert, survival rates for metastatic cancer patients is something that's very personal to me. And I would imagine that that's true for a lot of our listeners today. And your comment really resonated with me about how breakthroughs only matter if they reach the patients quickly. And so as many of these breakthroughs move through that discovery phase and the clinical trial phase that Janice is talking about, what changes do you believe would most meaningfully expand access to new treatments for more patients?
Well, Robert, real change must start with recognizing that cancer is the competition, not other providers. Organizations should not keep their knowledge, their research, and their tools to themselves. I speak all over the country, and when you speak in a room of 400, 500, 1,000 of your closest friends and ask for a show of hands, how many have been touched by cancer, either themselves or a loved one or a friend, all the hands go up. And what it highlights is it's simply cancer is simply too big a challenge for one organization to tackle alone. Just unfortunately, our care delivery system isn't structured in this country to get the latest treatments to the most people who need them. And as a result, we're losing sight over what matters most from the perspective of cancer patients. Too many patients are getting lost in a system not built for the realities of modern cancer care. Think of it this way. Nearly 40% of people in this country will be diagnosed with cancer in their lifetime, and yet only 20%, 1 in 5, receive their care at an NCI designated comprehensive cancer center like City of Hope or UCLA. So how do we change the dynamic? We need to encourage closer partnerships between academic centers and community providers. We need to make it easier for patients to access clinical trials regardless of where they live, and help patients get the right diagnosis from an expert in their disease type the very first time. We know that's their best chance of survival. And only making those changes a reality, it'll happen by working together across the healthcare system. Let me give you a quick example. We formed a company in partnership with other comprehensive cancer centers from across the country, Dana-Farber Emory, Fred Hutch, Johns Hopkins, Northwestern, UT Southwestern, and it was to partner with employers whose employees have cancer. And we now have 9 million members, about 700 employers, including 70 Fortune 500 companies. And the point is not to have patients come to one of those NCI centers, it's to support them in their community. And in 93% of those cases, this Access Hope is the name of the company. It's subspecialists make recommendations for improvements. And more than 85% of the time, the treating oncologist implements those suggestions, including almost 40% of the time identifying a relevant clinical trial. It's an example of what happens when different parts of the industry come together and realize that cancer is indeed the competition.
Thank you for that, Robert. So, Carl, I know in our practice, we think about trying to advance healthcare provider needs. And one of the challenges that we often face is, of course, on the financial side, but it's on the healthcare legal regulatory framework that these healthcare provider organizations operate in. And we know, everyone on this call, that California often presents a unique set of challenges. Carl, how does the healthcare outlook here in Los Angeles differ from what we're seeing across the rest of the country? And what should healthcare leaders be paying the closest attention to right now?
Thank you, Rob. And I'm going to throw you a little bit of a curveball, and I'm going to hit the regulatory piece later on. But so what I wanted to sort of address, we in California, we have a sort of an interesting, and in LA in particular, we have an interesting kind of fragmented market. But over half of LA County residents are Medi-Cal patients, and that puts a lot of pressure and stress on the population and on the providers financially. And we've already seen sort of some of the effects with the Big Beautiful Bill, for example. I have really the opportunity and privilege to be a board member on a local FQHC here in the South Bay. And we've seen, a steady monthly decline in patients, a couple percent every month in the patients that are enrolled in Medi-Cal, which is, raising a fair amount of financial pressure. And then on the state side, there's additional financial pressure. I know this is a little bit of a downer part of the topic, but it's a real issue. Several of the budget iterations in the past few months have had huge cuts to the Medi-Cal budget. Those, I think, have temporarily been stayed, so to speak, and are sort of being left, it looks like, for the next governor to have to deal with. So kind of from this financial pressure standpoint, I think that leaders are going to need to be looking for ways that they're going to be able to ensure a stable workforce. And I think, unfortunately, or maybe fortunately, it's going to mean folks are going to need to figure out how to do more with less. And kind of circling back to the incredible advancements we're seeing in AI and the opportunities there, I really do think that AI and technology is going to help providers develop tools to reduce administrative burdens on the workforce, and particularly clinicians, but they're going to need to be sort of carefully curated so that they actually do the improvements folks are looking for and don't inadvertently add additional work or confusion.
Chinese, I think that's an interesting point, because one of the things that we hear from our clients, and that I think we're seeing play out both at the federal policy level and across the states, is this growing emphasis on preventing illness before it requires more intensive treatment. Mm-hmm. And you had touched on the great work that UCLA Health is doing around its academic medicine and these public-private partnerships. And how is UCLA Health advancing prevention, early diagnosis, population health, and where are you seeing the greatest opportunities to improve patient outcomes?
Well, thank you, Robert. And also want to pick up on some of those excellent points that Carl made about the population that we're serving in Los Angeles with over 10 million people, all the health disparities that we're seeing, the rising numbers of people on governmental insurance programs. So certainly at UCLA Health, and I think really in the healthcare industry now in general, we're going to see a continued focus on population health management. We have a whole population health infrastructure that we support here to really look at that value-based care along every population. We also most recently, 2 years ago, launched our own Medicare Advantage program so that we could really do a much more effective job of managing health in our senior population. And what we do is really analyze and address the multiple factors that influence health of the whole population, not only their health status, but the social, environmental, and behavioral health determinants, with the aim of really preventing disease and promoting wellness in the community level. We know that socioeconomic and environmental factors significantly influence up to 80% of health outcomes. So highlighting that critical role through our population health and really serving as a hospital anchor network for diverse populations has really allowed us to strengthen resources in those areas. So we've really undertaken multiple strategies to improve population health. One of them, for example, is screening our patients in the domains of food needs, transportation, financial strain, prescription and medical bills, their housing capabilities, and also supporting them and connecting them with resources in the community to help bolster those. We really feel by addressing some of these underlying socioeconomic determinants, we're really working to prevent illness, improve outcomes, and promote long-term wellness across the many communities that we serve. Additionally, one of the things I wanted to mention to Carl's point about now with all the advances in we have tools to give us much better information on how to treat patients. But what we have to do as large institutions is really make sure that we're using the right tools that really drive those improvements, improve quality, and reduce cost without just layering costs on the healthcare system. And a lot of these tools are not free, as many of you know. So big investments in IT infrastructures. So one of the things that we did 2 years ago at UCLA Health, we hired our first chief AI officer for the health system to really look at the tools that we're bringing in and really how they are driving change. And just a few months ago, we launched a new project called Innova, which will serve as our dedicated AI evaluation center. And we hope to share that knowledge really across the country. But it will give us as a health system a trusted, evidence-based pathway to test and validate some of these new clinical and operational tools that are coming forward with AI.
Thank you, Janice. Carl, I want to come back to you. So we're hearing from UCLA Health and our colleagues about embracing new technology and about the challenges associated with, for example, addressing environmental and other social determinant of health factors that historically have been thought of as separate or apart from the medical or the health system. And there's now a growing recognition that those factors do, in fact, drive healthcare outcomes. That adds another layer of complexity. So not just the technological piece, but the literal services piece to that increasingly complicated regulatory environment. How would you describe, Carl, today's legal landscape, particularly as providers like UCLA Health and City of Hope adopt AI and other emerging technologies?
One word: complex. And it's only going to get more complex today. On the one hand, we've got a federal administration that's aggressively moving to deregulate agencies like the CMS, and then you layer on that 2028 is just around the corner. Who knows what's going to change there? And maybe leadership is going to need to be, readjusting sort of their game plan. And it makes it very difficult to, in that sort of environment, I think, for providers to make long-term plans and decisions, at least to some extent. And then you layer on in California and many other states where regulators are moving in the opposite direction. For example, in 2024, we saw a new law that requires providers to give the state written notice of any material transaction, of a certain size and a certain type before it can close, so that regulators can scrutinize potential anti-competitive effects and potential negative effects on costs and access. In terms of AI and other emerging technologies, we have seen federal action. We've seen some executive orders on AI trying to encourage the adoption of AI. And at the state level, I think nearly all of the states have advanced a number of bills that address AI regulation, and with several dozen having been signed into law. And these, addressing topics like protecting minors from mental health AI-enabled chatbots, to barring AI from making the clinical decision, something I think we would all agree with. And regarding patient interactions with AI with no clinical oversight. So I think as AI continues to grow and the use of it continues to grow, providers are going to need to become skilled at using it, so they can determine which AI is the right AI to sort of place the bet on. And then from a legal perspective, additional resources and time and effort are going to need to be spent to learn the different applicable AI regulatory requirements that are going to be put in place, and to put appropriate clinical and regulatory compliance policies in place.
I want to shift gears now just slightly to talk about medical advances more broadly. And so, Robert, you had mentioned that there's increasing partnerships and there's a nationwide effort to get cancer providers, for example, thinking about clinical trials in an organized way, and that there's increased collaboration across state borders and supporting these efforts. But many of the most exciting medical advances are becoming reality through groundbreaking research taking place right here in Southern California. Robert, how are clinical trials in the Los Angeles area making an impact? And why is this such an exciting time for medical advancement?
Well, so, Robert, for those who don't know about City of Hope's growth, our history is 100 plus years in Southern California. So this is our home, and we're now in 4 states across the country, 5 specialty hospitals, and 86 million people live within a short drive of one of City of Hope's hospitals. And the key to that growth has been the ability to create a single clinical trial network. And that's because clinical trials give patients access to innovative therapies before those treatments become widely available. And it helps researchers answer some of the most important questions of care. You have to understand that it often takes years to update the standard of care, and the best care for cancer is often a relevant clinical trial. We talk about at City of Hope that it's not as much bench to bedside, which is where it's the direction the information has flown for years. It's now bedside to bench and back to the bedside again. And what that means is that our researchers take learnings from the hundreds of clinical trials here in California, constantly improve the treatments we're developing, and then quickly make them available to patients across the network. We run, for just cancer, roughly 700 to 800 clinical trials a year, and that underscores the importance for patients. And thinking about how that goes across the country and the impact, If you have one institutional review board, one internal regulatory process, you can move more quickly. Remember, wait's a four-letter word to cancer patients. And the model's attractive and a way of partnering with biopharma and industry in general, because we can provide a wider access to a pool of patients. And we've had enormous industry examples and interest. Let me give you one example. Recently, you undoubtedly have heard of the new drug for pancreatic cancer, daraxonrasib. Say that many times over. We participated in the phase 3 trial that showed how the breakthrough can extend survival. And building on those insights, we're now able to make it available to patients in early access. I had a patient just the other day, an 88-year-old patient who had metastatic pancreatic cancer and had the chance for significant increase of survival time so that she could go back to enjoying life as she started taking those pills. That's the way we have to look at the future of how do we take clinical trials and make them available to more and more people.
Thank you, Robert. So, Carl, beyond the innovation that's happening on the clinical trial side and the research and the expansion of services to include or address some of those social determinants of health, one of the things that has come up a couple of times in the conversation that I want to come back to is that healthcare organizations must also build sustainable business models that allow them to continue serving their communities. And I know that you and I have talked about this before in the context of you serving on the board of such an organization. Carl, what will separate the providers that thrive from those that struggle as they work to remain financially sustainable while continuing to deliver high quality care?
So thanks, Robert. I think future reimbursement models are just going to continue to become even more value driven, and the providers that are comfortable living in a value-based environment, the ones that are already good at it, I think are ahead of the game. But those providers, I think, are gonna thrive, and the ones that aren't as comfortable and maybe haven't made the investments to become good at value-based care are going to struggle. And so for me, how do you become good at value-based care? I think Janice and Robert will know better than me, but from my perspective, it means you need to become an expert in your own data and your population's data and the community's health data. And that I think it's going to mean being able to organize it and analyze it in a way that you can aggressively and sort of confidently make data-driven decisions. And to circle back, because it's the word of the day, I really do think this is an area where artificial intelligence can be a game changer, and it can help providers unlock and understand their data. It can help them clean up sort of messy, hard to understand data. It could help them. I think in the future they'll be able to, predict patient risks before negative events happen. And as we sort of touched on before, it can help with the operations and workflow and resource allocation planning, and taking sort of automated tasks off of folks' shoulders and allowing them to focus on more efficient actions. So, and the lawyer's going to say this, all this is again going to circle back to, at least to some extent, learning and understanding the new regulatory paradigms and getting yourself set up to be able to operate under the new rules of use.
Thank you, Carl. Johnny's bringing it back to a little bit of an operational perspective. So we have talked about how UCLA Health is finding, let's say, new care to deliver, right, beyond just medical or traditional healthcare system services. But stepping past just the type of care, we're also seeing that care delivery is no longer something that just happens in a traditional hospital setting. Janice, how is UCLA Health approaching that continued growth of outpatient care? And what does that shift mean for your patients?
Well, thank you, Robert. And we, over the past 10 years, have continued to aggressively increase our outpatient care services. It's really been drawn by the increased demand for UCLA Health in the community and by patient preference for that convenient, accessible care and technological advancements that allow more procedures outside of our traditional hospitals. And this shift really reflects a broader industry move toward providing care closer to where patients live and work and in the lowest cost setting. So at UCLA Health, we now have over 300 clinics throughout Los Angeles and Southern California that not only provide primary care, but a lot of secondary specialty care, advanced imaging centers, outpatient surgical centers, and procedure centers. And we're committed to continuing to increase access to the high quality care that we provide. We also really have continued to expand our inpatient hospital beds because, as I mentioned, we're over 100% occupied. So one of the things that we did 2 years ago, we purchased a hospital in the Valley, and now we have UCLA West Valley, in addition to our 3 hospitals in Westwood and 1 in Santa Monica. One of the other exciting things that we're really pleased to bring forward for the community is our brand new state-of-the-art inpatient and outpatient mental health campus that will serve adults, pediatrics, adolescents, and geriatrics. That's the new Mid-Wilshire Hospital, which represents about a $650 million investment by UCLA in one of the most underserved populations in our community. Los Angeles is one of the least bedded communities for mental health, and many of us really have patients waiting for inpatient beds in our emergency departments every day. So we'll be adding 139 inpatient beds and a dedicated crisis triage unit that has an additional bed capacity, as well as an outpatient mental health building for a lot of our partial hospitalization programs, again, for patients of all ages. So we're really excited about that and look forward to announcing that in the fall.
Thank you, Janice. We've talked a lot about healthcare from the provider's perspective. And Robert, I'm hoping as our conversation starts to draw to a close, I'd love to hear your thoughts on the patient's perspective. And what do you think patients should take into consideration when selecting their healthcare provider or their hospital, given all of the challenges that a patient faces today in terms of understanding providers, care options, where to receive that care?
So, Robert, it's important to remember that patients are not the stakeholder of our healthcare system. They're the purpose. And yet, too often, their perspective is lost. I hear over and over again what patients are looking for when they have cancer. One, they want an expert in their specific type of cancer. They want, 2, access to the latest treatments and trials. And 3, this sounds simple, but it's amazing how many times I hear it's not provided. They want to be treated with dignity. Patients should never have to choose between being treated with dignity and respect on the one hand and receiving world-class expert care on the other. And remember, it impacts the entire family. So it's not just diagnosing and treating their disease, it's caring for the cancer patient and their families. I've said many times, and you've undoubtedly heard others say it many times, that the 3 hardest words cancer patient hears are "you have cancer." And I had somebody recently come up to me, a patient, after I'd said that, and they said those weren't the 3 hardest words for me. The 3 hardest words for me were "I have cancer." And the reason that was so hard was because I had to say those words to my mom. I had to say it to my kids. I had to say it to my husband, my family. And it was a recognition that cancer treats everyone. So regardless of where a patient gets their care in our national network, we try to take their hand and never let it go throughout the cancer journey. And long-winded answer to your question, cancer patients deserve expertise in their cancer, access to a clinical trial, and again, to be treated as a person who's fighting a disease, not as a disease in and of itself.
Thank you, Robert. Last question, and this one's for everyone in the group. We've covered a lot here today. We've talked about the financial sustainability of the healthcare delivery system. We've talked about challenges facing healthcare providers, including the healthcare legal framework. And we've also talked about innovation, research, and that patient experience. To close our discussion, I'd like for each of you to look ahead 5 years. What's one change you hope to see in healthcare? And what's one step that healthcare leaders should begin taking today to help make that future a reality? Janice, let's start with you.
Well, thank you. I hope we see a healthcare system that is far more accessible, personalized, and proactive, one that really helps the population and individuals stay healthy rather than simply treating them when they're sick. I think I'm hopeful about that because of the advances not only in artificial intelligence and digital tools and precision medicine, but the great work that's happening on the research front to really improve outcomes, reduce disparities, and make care really more effective for patients regardless of where they live. And I think as leaders, really to make that future a reality, we need to start today by investing not only in technology, but in people and in partnerships. Technology alone isn't the answer. We have to really equip our workforce with the skills to use these tools effectively, strengthen collaboration across the healthcare industry and with other types of industry that are really leading the way in some of these developments, to really continue to work with federal and state government on healthcare policy that helps us truly deliver the best care and keep our patients at the center of every decision we make. So I think in summary, if we can combine that innovation and compassion and maintain our focus on quality, access, and equity, I think we actually can build a better healthcare system that delivers better outcomes, better experience for patients, and a more sustainable future for all. And I think if we could do that here in Los Angeles, one of the most diverse communities in the country, I think we'll have a true measure of success.
Thank you, Janice. Carl?
Thanks, Rob. So not necessarily a change, but I would like to see everybody have access to primary care, every single person. And I know we've, over my career, which has been now over 20 years, which has gone by like a blink, but over my career, I know there's just been intense efforts by everybody to increase primary care access. But I think that's I guess maybe in my mind, the single thing that will help improve a population's health. And so I really would like to see that happen. And I know it's an incredibly difficult and complex question, and it has lots of different factors that are not in any one person's or stakeholders' control. I think it's going to require funding primary care. And I think it's going to require us, being as creative as possible, whether that's 103 or 104 nurse practitioners, using and funding more telehealth and more remote monitoring, mobile clinics, anything and everything. And, yes, AI, I think, is a tool that will help providers and clinicians be more efficient. But, I think we're going to have to do some of the basic blocking and tackling on primary care in order to make that a reality.
Thank you, Carl. And Robert?
I hope we reach a point where a patient's zip code, their insurance coverage, or their proximity to a major academic center no longer determines their chances of survival. Period. Stop. I think I mentioned earlier, we need to remember that cancer is the competition and think about changes to our healthcare ecosystem and look at it through the patient perspective. What that means in practice is closer partnerships among providers, and between payers and other partners. It means leveraging technology like we've talked about to make the latest expertise available in more places and make it available more quickly. Means making sure every patient can access a clinical trial, even if they don't live next door to an academic center. It means baking supportive care, caring for the individual's entire need and their family's needs, and baking survivorship into care plans. What's going to happen to a patient after their treatment ends? Too many patients feel left alone. And it also means pursuing innovation and research through the lens of what will actually have the greatest impact for as many patients as quickly as possible.
Thank you very much, Robert. And thank you to all of our panelists for joining us today. It's been a privilege, and these are really interesting and thought-provoking questions and comments. And I hope that we'll all have the opportunity to continue the conversation. Thank you again to our audience as well. Thank you for listening. And thank you, of course, to the Los Angeles Business Journal for hosting our roundtable discussion. Back to you, Josh.
Well, that wraps up today's roundtable. I want to thank all of you so much for being a part of this. Robert, Carl, Janice, and Robert, thank you for sharing your insights on the future of healthcare and for all of the work that you're doing to advance research, innovation, and obviously the long-term strength of our healthcare system. To our audience, I want to thank you all for joining us. We hope that you enjoyed today's discussion. I know that you probably learned a lot, as much as I did. Please feel free to share this to your friends, your colleagues, and others in the community who you think would value from it. Thank you. We look forward to hosting you again soon.